Define hospice and hospice care. Hospice care is a type of care and philosophy of care that focuses on the palliation of a chronically ill, terminally ill, or seriously ill patient's pain and symptoms, and attending to their emotional and spiritual needs. Palliative care, pronounced palliative, is specialized medical care for people with serious illnesses. It focuses on providing patients with relief from symptoms, pain, and stress of a serious illness, whatever the diagnosis. The goal is to improve quality of life for both the patient and the family. Palliative care is provided by a team of doctors, nurses, and other specialists who work together with a patient's other doctors to provide an extra layer of support. It is appropriate at any age and at any stage in a serious illness and can be provided along with a curative treatment. Toward the end of the 19th century, hospices became designated places for the care of terminal patients in Ireland and England. The modern concept of hospice was later developed in England in 1967 by Dr. Cicely Saunders. St. Christopher's Hospice was the first hospice under the direction of Dr. Saunders. Hospice is considered long-term care.
How is hospice care reimbursed? Hospice is paid for through the Medicare hospice benefit, Medicaid hospice benefit, most private insurers. If a person does not have coverage through Medicare, Medicaid, or a private insurance company, hospice will work with the person and their family to ensure needed services can be provided. What is the role of CMS in regulating and reimbursing hospice care? CMS has released a proposed rule to revise and update Medicare hospice payment rates and the wage indexes for fiscal year 2014. The proposed rule would provide hospices with an approximately 1.1% increase in Medicare reimbursement during 2014. Per diem rates would increase by approximately 1.8%. This means that the role of CMS in regulating and reimbursing hospice care is a pretty big role. It seems that CMS regulates this pretty closely. Does Medicaid play a role in regulating or reimbursing hospice care? On August 4th, 2014, the Centers for Medicare and Medicaid Services, CMS, issued a final rule to update the Medicare Hospice Wage Index and Medicare hospice payment rates for fiscal year 2015. Hospices serving Medicare beneficiaries would see an estimated 1.4% increase in their payments for the fiscal year of 2015, or $230 million. With this being said, yes, Medicaid does play a role in reimbursing hospice care. I say yes because CMS, which is the Centers for Medicaid and Medicare, is the agency that is dealing with regulating hospice care. So it is not just Medicare, but also Medicaid. What is the organizational structure of typical hospice care organization? The board, then CEO, next would be consultant, medical director, clinical service manager, operations director, finance manager, and the head of fundraising. This seems to be a good depiction of the typical structure of the hospice care organization. What professional advocacy organizations represent the hospice segment of the healthcare industry? National Association for Home Care and Hospice, National Hospice and Palliative Care, the American Academy of Hospice and Palliative Medicine, American Geriatric Society, Hospice and Palliative Nurses Association. Is this one? Describe the hospice care segment of the industry. The hospice And palliative care centers industry has continued to grow over the past 5 years, and the outlook period for the next 5 years will be no different. As the aging population increases through the baby boomer generation, however, healthcare reform could lessen the amount of reimbursement from assistance programs, which would damage. How large is its revenue? Roughly $22 billion.
And to continue with that, the total patients served is roughly 1.7 million patients. The total patients with Medicare using hospice in 2013 is 1.6 to 1.7 million patients who are receiving hospice care. In 2013, 2/3 of patients received care at home. The percentage of hospice patients receiving care in a hospice inpatient facility decreased from 27.4% to 26.4%. Medicare users who use hospice services range 8% who have accessed hospice for 3 or more days, but by 2007, the proportion of Medicare users accessing 3 or more days of hospice care rose to 30.1%, and they continue to rise. The number of jobs that make up this segment is about 231,267. It has an annual growth rate of 8%. Some examples of hospice organizations that serve Southeast Idaho are the Solace Hospital, or Solace, I don't know, Hospice of Eastern Idaho, Alliance Hospice Care, and Hands of Hope Hospice. I was able to contact one person that was an assistant manager. Her name is Meredith Knowlton, and she worked at a home and health hospice in Salt Lake City. And these are the questions I asked her, and these were the answers she gave me. I asked her, what are some of the opportunities with managing a hospice? And she said, despite legislation cutting services that will be reimbursed by Medicare, I can say with full certainty that hospice care will always be funded and to a point take precedence to other healthcare services offered by government spending. This is because hospice care is significantly cheaper than compared to other care offered. A large bulk of healthcare spending is spent on a person's last 2 to 3 weeks of life. This is partially due to physicians not being able to call it quits with a terminal patient or their family wanting to do all they can to prolong their loved one's life. We in the healthcare industry, as well as those in legislation, realize that promoting hospice care as an alternative for the last weeks of life would greatly lower healthcare costs for the terminally ill. I asked her what the challenges were, and she said, the most prevalent challenge with this industry is handling the emotional pitfalls with caring for those with 6 months or less of life to live. By this point, many of our patients have come to peace with this and often are grateful to be done with aggressive treatments to sustain life. Their families, on the other hand, need constant reassurance and comfort during this time. When hiring staff, I always make it a point to have them ask themselves how okay they are with dealing with death on an ongoing basis. The financial challenges come when services are needed that are not covered by Medicare. Legislation has cut and will continue to cut services for hospice care, and we must do the same to retain a decent profit margin. Hospice care also has an abundance of quality care regulation and unique requirements, such as that hospices must retain volunteers on staff. Adhering to these requirements is often a headache. Finally, I asked her, do you see hospice care as a lucrative segment of the industry, you know, something that we should look into for jobs? And she said, hospice care can be lucrative if you only take on patients with insurance and only offer the basic services that Medicare reimburses for. About 3/4 of our costs are reimbursed by Medicare. And that is our presentation.
Thank you.
Thanks.
Okay, guys, I just stopped the broadcast.
Yay! That was pretty good. Sorry I didn't start